As New York Assembly members prepare to meet next week to go over the findings from their impeachment probe into ex-Governor Andrew Cuomo, we are getting a look at testimony from a former top official in his administration about what was going on at the state health department during the early days of the pandemic. Linda Schmidt's been going through the document. She joins us now with what we are learning. Linda.
Yeah, hi there, Steve. And what she had to say is alarming. Now, she ultimately ended up resigning, along with other state health department employees who say that Andrew Cuomo prevented them in some ways from properly handling the pandemic.
She is referred to as state employee number 2 in the Cuomo transcripts released by the state attorney general's office this week. She is a former top infectious disease expert with the state health department. She says during the height of the pandemic, we were not allowed to collaborate with our peers in the local health departments and New York City Department of Mental Health and Hygiene, which is a critical component in an outbreak, certainly during a pandemic. She goes on to say, we weren't really able to communicate with them openly as we normally would, or send out information and updates as we normally would. These were things that had to go through approval and would either not be approved or it would take so many months it was quite out of date. She testified she also raised red flags with the health department's legal affairs director when she discovered COVID-19 test results from the Wadsworth Center state lab were not being shared. She asked him to speak to the governor's office. I just want you to tell them to stop. The labs have to get to the doctors and the local health departments immediately with this disease. It's very important. Bill Hammond is the senior fellow for health policy for an independent think tank in Albany.
It was kind of striking to see this coming from the mouth of somebody who was in the department, an MD, an epidemiologist, who had experience in previous pandemics.
Nearly a dozen state health department employees quit in the last year, reportedly out of frustration because they felt their hands were tied by the governor's office.
It's mystifying and it demands investigation. If I was a member of the legislature, I'd be extremely curious to hear what these people have to say.
And of course, today we also reached out to a spokesperson for Andrew Cuomo, but so far we have not heard back.